Mini dental implants. What are they? How are they done? Who are they for? And are they for you? We find out next on Trending Health. Hello and welcome to Trending Health. I'm your host, Kevin Sylvester. Glad to have you with us here, as today we're going to learn about mini dental implants and if they're right for you. And joining me today to tell us more about that is Dr. Joe Richter from Fairfield Family Dentistry. Joe, great to have you here.
Thanks for having me.
Well, let's first, before we get into what a mini dental implant is, let's learn more about you. It's a family dentistry practice,
Right.
And you've joined your father in the practice.
Yes, I have. So I've been at that practice now for a little over 4 years. Before I was there, I was at a Medicaid type clinic in the downtown Cincinnati area. Enjoyed that, but I'm also enjoying what I'm doing now.
Yeah, and I'm sure your father's great. Glad to have you with the family practice, and it sounds like you did some great work.
It's neat to have some long-term planning goals and everything come together, and have the two of us work together, certainly.
And your life's been goal-oriented. Some folks may say, boy, Joe Richter, I remember reading about him in high school football, accomplished career, college career.
Yes. So in high school, I went to St. X. I was lucky enough to be a part of the 05 and 07 state teams there. And then from there, again, lucky enough to go on to play in college at Ohio Dominican, which is a smaller school up in Columbus. D2, I was not good enough to be at that big school in Columbus, but I was happy to be able to do that and learned a lot along the way.
I don't know if anybody knows what big school you're talking about.
I would have no idea. Yep.
Defensive end, by the way.
Yes.
So that's a fun position to play with that. Well, we're going to try to sack some bad oral hygiene here.
Very good.
Some folks may have, need some solutions for them. And one of them is mini dental implants. And this might be the first time you're hearing about a mini dental implant. So can you explain to us what a mini dental implant is?
So the hot topic in dentistry has always kind of been implants. Implants are kind of the bigger, higher end, glitzier, fancier things. Mini dental implants kind of bridges that gap. It's something, there's less pieces involved with it. The procedure is quicker, timelier, and less invasive. And what that allows is for something that used to be maybe unattainable for some, cuts it in to where anyone can have it now. This makes dental implants right for almost anyone out there, okay? Which is, I'm very happy to be able to provide that service for anyone out there who needs it, because it is a needed thing.
Yeah, we're going to get into whether this is for you or not coming up here on the show, and just what that will entail. The implant itself, we talk about perhaps the technology of it, exactly what it is, because you mentioned a lot of things that are less invasive. There's less material, if you will, used. To just kind of tell us about the technology that has allowed this advancement for patients.
So you say mini dental implant, but it's essentially a tiny little screw that you will go in, drill a small pilot hole just straight through the gums, and just thread that tiny screw right into that little hole. We get you nice and numb in that area. You feel maybe a little bit of pushing, pressure type things, but very, very painless. And it's done. I can't tell you the number of reactions that I get done and say, okay, it's in there. And the patient's like, oh,
Yeah, right.
You're done?
That's it, right?
That's it. Yep. So
maybe that's part of the mini part
right
for them there.
Yep.
May not take a whole day. You talk about just screwing the. So is this for one tooth? Is it multiple tooth? I know we have some models. Can dentures be anchored to this? How many applications are there?
Basically as many applications as there are for replacing teeth. That's their main goal, is to replace a missing tooth, whether that be one tooth, two teeth, three teeth, all of your teeth. That's just all very situational.
Well, so that sounds like it's a great solution for a lot of people with this. Some might wonder, I know this with crowns because I have one, but the color matching, how does that process work? And can mini dental implants, can it be color matched to the person's certain teeth now?
As far as color match, shade match, in the anterior especially, you match that as you would any other crown. The implant itself does not affect the shade match at all.
Yeah, so I'm guessing that's so when someone sees them in a photo or their $1 million smile, people can't tell, can they?
The goal is to always be inconspicuous.
That's what a good dentist is.
Exactly.
For sure there. So, you mentioned it's a screw there. So how many screws would go in if you needed is it one screw per tooth?
Depends on the application and how we're restoring your specific situation. They can be used if we're doing, say, a lower denture implant stabilization, which is, in my opinion, one of the greatest things that these things do. You put in 4 screws, and then you will take the denture itself and line them up on all of those screws. How it works is there is a O-ball on top of the implant itself, and then down into the denture here, we embed an O-ring, and it just snaps over that O-ball to give it some nice retention.
And so that looks like it eliminates a lot of things for the patient.
Especially on a lower denture.
Yes. Glue, right? The goop and maintenance, I'm sure, is probably easier. I mean, is it removable for them on a daily basis?
So there's, again, different applications.
Sure.
The bread and butter, I would say, is the lower denture stabilization. That does come in and out on a daily basis. You would clean that twice a day, just like you would brush your teeth. But otherwise, they stay in there, okay? We also, if we want to do more implants, we can have something that is what we consider semi-permanent. That only comes out in the office every 6 months, like you would go in to get your 6-month cleanings.
All right, Dr. Joe, you got 2 more models that I'm curious about. Let's start with this one right here.
Okay, so this one will be our semi-permanent solution, where we put in anywhere from 8 to 12 implants, depending on arch and how much bone there is to work with. Okay, it does look a little gnarly in the mouth itself, but what this lets us do is embed those O-ring housings directly into this prosthesis, and you can tell there is a lot less material on this than there is even on this conventional denture that we were able to cut the palate out of. Up here, much less material through the roof of the mouth, and then much less along here as well. And what's very nice about these is that day to day, this does not come in and out. This will stay with you throughout your day. You wake up, it's in. You go to bed, it's in. The only time this will come out is in the office. We come in to do your every 6-month check like you would with your natural regular teeth. I take this out. The hygienist will clean around your implants. She will clean the prosthesis itself. I come back at the end and pop it in for you.
That seems very convenient for somebody who's probably lived inconvenient with their teeth for quite some time.
Certainly.
I bet the freedom of living with that is probably more fun for everybody.
I would imagine.
Speaking of fun, looks like you brought a dinosaur fossil here. What is this one?
So this is actually a human mandible, an example of it.
So that's the lower jaw.
Yes. What this shows is the size of the hole needed for a conventional style of implant. This would be when someone generally says dental implant, this would be the hole that goes along with it, okay? You can see from the size of this hole, there is more removal of tissue. More removal of tissue means longer healing time and more post-op discomfort for the patient itself. Here, we have a much, much smaller insertion hole. Again, less removal of material means less pain, less discomfort, and faster healing for you.
That looks like a crater compared to a pinhole for the mini dental implant.
Certainly.
And I'm thinking, the less bone you have to take out or drill into, probably the better for the patient, right?
It certainly is. That also means that you have much better vasculature around this than you do here, and vasculature is how these things heal. You have to have the blood flow to go into these implants to get it to integrate into your bone. If you remove that vasculature around this area, you lose, that's what that extra healing is for, because it takes longer to replace that. With this, you don't remove nearly as much, so things just heal quicker naturally.
Sounds like there is a lot of applications for these mini dental implants, and we'll get into who and whom these are for in just a moment. But one more question about those screws. And this is what alloy are they made of? I've heard titanium is what they're made of, and that the advantages of titanium.
Titanium is a very biocompatible product that's used very commonly, even for knee replacements, hip replacements, all that stuff, and now we're just replacing teeth with it.
All right, so better for the body.
Right.
And it works better with that. So we mentioned there are many different applications for this mini dental implant. The question is going to be, is this for you? Well, we will answer that question right after this.
I'm very thankful that mini dental implants have arrived in time for me to take advantage of them.
I was missing some teeth. Some of my teeth were cracked. My front ones were all chipped, and pieces of my filling were falling out. So I thought, this is it. This is what I'm going to do. I'm going to go and get this done. I didn't want dentures, and I knew that the implants would be more expensive, but this was really affordable, very affordable.
The mini implant is not that invasive. He had the implants in before I knew it.
Getting the mini dental implants was a life changer for me. Going from having my bridge removed to knowing that I would have a partial in my mouth was pretty upsetting, and I was afraid to smile, and it brought a lot of confidence back to me.
I have almost a full mouth of teeth now that I didn't have before. They're so good that my daughter didn't even know I had them done. So they look like my own teeth.
I was very surprised. I expected pain going into the gum and into the bone, and to be honest, it felt like putting a knife in the soft butter. Like, you can feel it a little bit, but no pain whatsoever, which was very surprising.
Yesterday, I had 4 implants put in here. I took 3 a leave, and that was it.
I had no pain. I was surprised, you know. Even though he extracted a tooth, I had no pain. You know, it was not even to take an aspirin, nothing.
Thank you for being with us here on Trending Health. We're learning about mini dental implants and if they're right for you, and glad to have Dr. Joe Richter with us here from Fairfield Family Dentistry. All right, so last segment, we talked about what they are, fascinating models, and how they're done. Who is your typical patient? Who is this for?
Really anyone and everyone. If you're missing a tooth, these can be used to replace that tooth for you. Whether there's 1 tooth, 2 teeth, 3 teeth, or an entire denture.
So that's a lot of people. You're right. That is for anybody. And if that describes you and you're looking for that solution, by the way, you see information there at the bottom of your screen on how you can set up an appointment, whether it be a phone call or at the website that's got a lot of great information for you at Fairfield Family Dentistry. Your typical patient, is it someone who comes in who has a denture? I'm thinking specifically of some people come in, probably they want to improve their life.
We see all across the board. We see people that, they're actually doing fairly good, but they don't think they are. They haven't been in for a few years. They're worried that they have all this stuff going on, but turns out they really don't. They're just missing the 1 tooth. Mm-hmm. We can replace that tooth. We see people that come in, they've been told by another office that they cannot get an implant because with a conventional implant, those are wider. So they only fit into certain spaces. These mini implants are very, very thin, but long, which is where they gain their strength from. So we can use them in more applications. So potentially a person that's been told you cannot receive an implant in this spot, we might be able to get an implant in there. And then the other situation that we see often is denture wearers, either new or long-term denture wearers. People that come in, especially with lower dentures, they always struggle with them. We can put implants in that situation to help hold in that denture, which can vastly improve your quality of life.
Yeah, it improves what they're able to eat. Probably see people smile more in photos. Talk better, right? I mean, people think about food and smiling, but communication, loose dentures certainly impact that a lot,
Yes.
don't they?
Yes.
Can this be a solution for instead of root canals, or is that not the case?
Potentially. The best thing that there is will always be your own natural tooth. Root canals, I feel, sometimes get a bad rap because they end up failing. But what the goal of that root canal is to keep that tooth in there for longer. Implants are great. They're not quite your own tooth. But If you do the root canal, it gives you more time to rely less on this implant. A tooth can fail, an implant can fail.
All right, but that's why we have many dental implants to do the best we can with that failure and have that quality of life. All right, so again, if you want to book that appointment, a consultation with Dr. Joe, you're going to see the number and information on your screen there. Let's talk about that consultation. What is that like? You know, some people have apprehension to go to the dentist. I'm sure you take every precaution with that to make people feel comfortable and welcome when they come.
Certainly. Our implant consultations are free of charge. Once you come in, we have a very friendly, welcoming staff. They'll get you more comfortable the second you walk through that door, and sometimes that's the hardest part, is walking through the door.
Sure.
And then from there, you'll generally be seated. I'll come take a look, kind of see what we might be thinking. And then from there, if implants are something that we're talking about, we'll take a CT scan directly in office, again, free of charge. I will go evaluate the CT scan, come back, probably take another look, and then we'll start talking what kind of treatment I think you may need, and then potentially what prices that could be.
All right, see, there you go. You see Dr. Joe on TV, call up, say, I saw Dr. Joe on TV, I want to come see him in person. Handsome fellow anyways, right there to come see the dentist in person, that consultation. It is no obligation and free. And I think that matters to folks there too, because we're all trying to watch our wallets right now here, and you're going to give it to them straight, aren't you, Dr. Joe?
Yep.
If it can be done, we'll do it. If not, hey, maybe we have other solutions for you here to help you out.
Certainly.
That day of the procedure, that schedule, what is that day like? Should they bring a buddy with them? Should they bring a spouse with them? What should they do?
Day of the procedure is different for the different applications. If you're doing a single tooth, generally how that goes, if it's a front tooth, we'll put it in. I'll make you a temporary crown, which looks good, but the finals always look better.
Mm-hmm.
We will let that sit with the temporary for roughly 2 months or so. Just make sure that implant's going to take, that your body's going to accept it, that it's going to hold in there nice and strong to be able to do what we need it to do. After that 2 months, we bring you back, check on it, ensure everything I just talked about is happening, and we will take our impression for the crown. It takes about a month or so to get that final crown made up, but then after that month, we'll get it seated in there, and that's when things look seamless. That's the inconspicuous dentistry.
Right.
From there, as far as denture stabilization goes, there's obviously some lead up time to make that denture, get that denture made in and of itself. And then the day of that appointment, we'll bring you in. If we're doing a lower denture, 4 implants go in. We line everything up generally the same day. Sometimes if I have to search, look for bone type of thing, we have to bring you back and you leave with a temporary liner. But generally we can get it all done in our 2-hour appointment.
So that's where it's the less invasive part there, procedure-wise. And you were mentioning before the show here that when people are done, they're like, that's it? Like they are expecting it to be, a 3-day hospital stay in major surgery. That's not the case.
Yep. Generally what I tell people post-operatively is you might see some bruising, you might see a little swelling, but normally it's on the level of a moderate level headache, pain-wise.
Yeah.
My general prescription is ibuprofen, and I really don't have people come back saying, oh, doc, I needed more. They're saying, I didn't even take the ibuprofen.
Sure. Well, that means he did it right, by the way. And the other thing I heard there, too, when you're talking about the process, I heard that you're thorough. You want to make sure this works for your patients, right?
Definitely.
We want happy customers coming out of there, happy patients coming out of there. And the fact that we're making sure everything is the right way it's supposed to be. That's the life-changing part, because it's going to last. And the third part I heard about that, hopefully I said 3 things. The third part I heard about that is get that appointment now for that consultation because of the process that it takes here. It might be 3 months till things are set, we're done, that inconspicuous dentistry where you're going to smile for friends at lunch and they're going to be like, there's something different, I can't quite tell what it is. But because of that process, that's where they should book that consultation now so they can get it and get it started.
If you have that wedding or that vacation or whatever have you coming up, get into me well before so that we can have everything set and ready. You can be comfortable with the treatment and we can have it all squared away for your wedding, your event, whatever it may be.
Yeah, hey, doing things right takes time, takes the proper technique and time, and that's what Dr. Joe is going to do for you. All right, when we come back, we're going to talk about who's paying for this. We're going to help you out with that too when we come back. Stay with us.
I was in here for like 30 minutes and it was done. It was done, over, done. Go home and eat. And my teeth aren't falling out of my mouth.
I've had 5 implants so far. I've got 1 more or 2 more to go. I'm very satisfied. I would recommend it to my friends.
It's the best decision I ever made, so it's well worth it.
Smiling before I had the mini dental implants, I was a little bit paranoid. And now I'm very happy to smile and laugh, to be honest.
I do smile a lot now. They're the best. They are.
My dental implant has changed my life. I can eat whatever I want. I don't have to worry about being embarrassed going to a restaurant and biting into a piece of steak and my denture coming out of my mouth.
I would definitely recommend mini dental implants to everyone that can get it done.
Oh, I would tell my friends. I have told my friends. I have. I said, and anyone who has dentures, which could be in my future, I said, this is a miracle. This is something that is so incredible.
It hasn't made my life easier, it sure has. Big time.
Not a second thought about it. I would do it again. I even put it out on my Facebook.
Mini dental implants are my miracle.
Mini dental implants have changed my life. They have.
Dr. Joe Richter is a founding member of Mini Implant Mentors, Chief Medical Officer at Crown Dental Group, and the owner of Fairfield Family Dentistry. Dr. Richter is regarded as an expert throughout the country and shares his expertise and insights with other dental professionals, serving as a mentor. His staff also recognize his ability to make treatment plans clear and precise.
He's very straightforward with the patients, but he helps guide them through everything. He answers all of their questions, he helps them through each of the process, and just is very there for the patient, whether it be, everything dental-wise or whatever is going on through their life, he helped them through that.
Call the number on your screen to book a free consultation with Fairfield Family Dentistry and Dr. Joe Richter today. We're back here on Trending Health. I am Kevin. He is Dr. Joe. You probably know that by now. But just in case you're joining us here for the moment, we've been talking about mini dental implants. And so just recap before we tell you how you're going to make this great investment to improve your life. So Dr. Joe, again, just real quick, what is a mini dental implant?
So a mini dental implant is essentially just a smaller implant. You hear all this rave about getting implants to replace teeth. This is the exact same thing, just smaller.
And this is for not only people missing teeth, but folks who are having problems with dentures.
Right. It is usable across almost all applications of replacing teeth, whether that be a crown, a bridge, or a full denture, or even in some cases, a hybrid denture that only comes out every 6 months in the office.
All right, so if you have a problem with your dentures, you have a missing tooth there, or perhaps a implant has been talked, this is a less invasive procedure for implant there. Longevity. How long will this last? I mean, whether they do the options we've shown, whether it be 1 tooth, whether it be 3 teeth, whether it be a denture, how permanent or how long is this going to last?
The goal is always take it with you. That's what I tell them in the office. But it's not a set it and forget it. Okay, there is some responsibility on you to take care of these things. You are making an investment. You would take care of your car, take care of your investment. That happens to be your teeth.
All right, yeah, you're investing in yourself when you decide to go see Dr. Joe Richter and get a mini dental implant or denture here. Now, a couple of things we want to point out here. Obviously, in the Cincinnati area, but if you're outside the Cincinnati area, that doesn't mean you're not eligible to be a patient. You have patients coming from all over the place, right?
We do. We routinely have people coming from Indiana, Batesville. We have people coming from Wilmington, Ohio. We get people from Covington across the river down in Kentucky. We even have a few patients coming all the way down from Columbus.
All right, and if they come down and stay overnight at procedure, they can still enjoy the Skyline chili.
There's the Skyline right up the street.
All right, there you go. See, you can make a day out of it when you come in. Some folks may also wonder, well, I'm not currently a patient. You are accepting new patients, correct?
Certainly, yes.
All right, so that's a great reason to book that consultation and come for the appointment. You probably want to bring somebody with you too. Again, this is an investment like any investment you're going to make, procedure to have done. You may want another set of eyes and ears there with you just to get the information and help you make that decision. Insurance. People probably have that question, does insurance cover this? All insurances are different. Probably helps a little bit, right?
All insurances are different. Some do cover them, some are better than others, but we have a very welcoming, friendly staff that will help walk you through what your particular insurance might help with in your situation.
Yeah, so Dr. Joe has experts in the office to kind of take you through that and what your insurance is going to do. I know I have dental insurance, and every time, whether it be my kids go or I go, like I always have questions. All right, what is covered? Right. What is not covered there? So those questions will be answered when you go to Dr. Joe's office. Now, for folks who maybe don't have insurance or the insurance doesn't cover the procedure, tell us how you work with them.
So a couple of different ways to go about that. There are financing options available within the office. Again, the front desk staff will be more than happy to walk you through the ins and outs of doing the finance option. If you're someone that's able to do it out of your pocket, again, that's something that I personally notice, and I will work with you to make that more accessible for your situation.
All right, that's fantastic. No, also there, Dr. Joe's willing to work with you. And I'm guessing because of the results you see from your patients.
Yes, certainly. It is a rewarding experience to be able to do this. In particular, those people that have struggled with lower dentures for a long, long time. Being able to put that in there, give that person that self-confidence to be able to go out, eat, talk, go to dinner with their friends, and not have to worry, is my denture going to come flying out of my mouth?
Sure. Probably sending you photos with big smiles on their face,
yes,
right? All the fun they're
happens.
having
Yes.
with that. Is it that 6-month appointment when they come back, that 1-year appointment? I'm probably guessing you're still getting those comments from patients like, hey, Bill, you told me this 2 years ago. They're still telling you, right?
They still are, certainly, yep.
Yeah, that's great to hear that this could change your life, your lifestyle, where you go out to eat, if you love steak, all those certain things that you could do when before they had some issues with their teeth. They are back to that lifestyle. So if maybe you're hesitating out there thinking, is this for me? What would you tell them about making that consultation?
I would tell them, call the number at the bottom. Sometimes that's the hardest step. Once you get through that door, though, we'll take good care of you, do everything we can to make you feel at home, and treat you like a real human being.
Yeah, and we were talking about financing. That consultation's free, by the way. Dr. Joe is going to see you, go through everything. That is a free consultation to find out just exactly what's going on with you. Everybody's unique too. This is not everybody comes in, this is what you're exactly getting, right? Everybody's unique with this.
Yes, certainly.
All right, so make that call today for that free consultation and look to change your life with an investment in mini dental implants with Dr. Joe Richter. Thanks for joining us here on Trending Health.